So lasers in clinic, why do we use them? We use them for one reason only. There really isn't anything better to try to reduce the abundance of inflammation and increase cellular healing. Increase the speed of your healing and to decrease the amount of time that you're in pain. To understand how lasers work, the easiest analogy is to understand that light is actually information. Now, that may seem like a strange thing to think about, but if we think about for a moment UV light, and so UV light emitted all the time from the sun interacts with our body and and particularly a cell called a melanocyte, and then the melanocyte produces melanin, and then melanin causes us to tan. So we understand that UV light, its mathematical measurement is 311 nanometers, which is 311 billionths of a millimeter, actually provides the information for my cells, my melanocytes, to produce melanin in order to help me tan. And the other thing it does, of course, is interacts with my cholesterol in order to help create vitamin D. So at 311 nanometers, the UV light creates vitamin D and helps me tan. A little bit further down the road at 650 and perhaps 810 to 850 nanometers, we produce deep red and near infrared light, which is the type of light wavelength that we use in clinic for our laser. Now, what the laser light of that frequency does is it signals our powerhouse of our cell, our mitochondria, to actually produce more ATP. Now, the reason why that's important is most people believe, I think, that the food that we eat creates the fuel that our body needs to actually run everything. And of course, that's not strictly true. What actually happens is that when we eat our food for our lunch, that gets converted into a little packet of sugar, and then that sugar goes through something called Krebs cycle, and that Krebs cycle looks to convert that sugar into ATP. And in order to do that, it needs to have red light coming from the sun at a certain wavelength in order to interfere with our mitochondria in order to create 34 molecules of ATP. And the reason why ATP is so important, it might surprise you to know that if I held my breath, I probably could hold my breath for perhaps 2 minutes. If I went without water, I possibly could go without water for maybe 2 days, perhaps. And if I went without food, perhaps a month, maybe a month and a half. But if I went without ATP, I could last exactly 11 seconds. In fact, ATP is so important that actually we produce our own body weight in ATP every single day. And so to give you an example of that, if I cut myself, a little paper cut, if I want a little fibroblast to walk to the site of the injury, I need ATP to do it. And if when at the site of the injury, I want the little fibroblast to create some collagen in order to help knit and clot the cut, again, I need ATP to do that. And so without ATP, I simply cannot heal. I can't do any process, in fact. And what the red light therapy, the studies have shown, is probably the best thing in order to promote production of more ATP, and particularly more ATP at the site of the injury to heal quicker. And so it can help heal the cells quicker and also reduce the inflammation. And remember, the inflammation carries the neurotransmitters that our brain then receives to say, okay, the tissue structure is damaged, and then we experience pain. So it's really, really important by using the laser, which can penetrate into the skin, we actually try to reduce the inflammation to reduce pain and increase healing as quickly as possible. And that's why we use the lasers. Thank you.